Hello and welcome. You're watching Health and Wellness. I'm Karki Rawat. Life is valuable and precious, and being able to revive a person's heart to save their life will provide one with immense satisfaction. It's a sad but true fact that the number of people dying from cardiovascular disease is steadily rising in India, and most of these cardiac deaths are sudden and on the spot. It's possible to prevent these sudden cardiac deaths if they receive immediate medical attention and CPR. The recent incidences of some celebrities collapsing suddenly and passing away due to a heart attack are concerning and shocking. There's an alarming rise in the number of young patients with heart attacks and sudden cardiac arrest. What is equally scary is that sudden cardiac death may happen in people who have no known history of heart disease. The risk is higher for patients with existing heart disease. In almost every family, we have at least one family member with heart disease. So can one make themselves capable enough to save a life in an emergency situation? Well, yes, it is possible if you are well trained in CPR. Many adults in cardiac arrest can be revived with intact neurologic function if the bystanders provide immediate CPR. Raising public awareness and understanding of the practical applications of CPR is an essential strategy to increase the success rate of CPRs in cardiac arrest cases. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest, train them on CPR, and highlight the role of CPR in saving a life. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. We're joined by Dr. Vinod Kumar, consultant interventional cardiologist, the Corporate Hospital, Amritsar. Dr. Nagamalesh UM, Professor and Head, Department of Cardiology, Ramaya Narayan Heart Center, Bengaluru. And Dr. Mayur Jain, Senior Interventional Cardiologist, Director, JIN Kaushal Cardiac Care, Thane. Thank you so much, doctors, for joining us today to speak about this very important issue and raising awareness about CPR and how people can, change from bystanders to somebody who can actually save a life. Now, Dr. Jain, my first question to you, while not all heart problems have the same symptoms as depicted in movies, certain indications are worth noting and scheduling a doctor's appointment. So how does someone know if he or she has a heart problem?
A great question by you, thank you. In fact, heart attack is only one of the heart diseases. There are many heart diseases. What is shown in movies doesn't happen in every heart attack. Elderly and diabetics can in fact get a heart attack without any chest pain. That is called a silent heart attack. People keep ignoring many symptoms for months altogether before they end up getting a heart attack, like breathlessness on exertion, pain on exertion in the chest, shoulders, arms, jaw, neck. These are all the sites where the heart pain can be felt. Fatigue is another symptom of heart failure. Sweating, giddiness can be the symptoms of coronary blockages. In fact, if we do cardiac checkups routinely like 2D echo and a treadmill test at an early stage, we can diagnose most of these patients with blockages before they end up getting a heart attack. There are also valve disorders which can cause only breathlessness or giddiness. Some patients do suffer from rhythm disorders like complete heart block. They can have history of falls or syncope. They become suddenly unconscious for a few seconds. Sudden cardiac arrest is another drastic symptom of many ventricular arrhythmias or abnormal rhythms of the heart, where the heart beats to about 180 to 200 beats per minute and suddenly stops. So definitely what is shown in movies is not the only symptom of heart disease. There are many symptoms, and these should not be ignored.
Right, very important to keep all that in mind. Dr. Nagamalesh, even if you maintain a healthy lifestyle, does having a family history of heart attacks then increase your risk of sudden heart attack?
Yes, family history of heart attack is one of the risk factors to have heart attack. Not that if you maintain your good health or lifestyle, if so irrespective of having the risk factor, you are going to get the heart attack. So what happens, you can consider family history of heart disease as one of the risk factors for heart attack. In one of the study which is conducted in Bangalore, it shows 16% of the people who had heart attack had history of family history of heart disease. So by maintaining good lifestyle, that is control of diabetes, control of hypertension, and preventing obesity, controlling cholesterol, we can reduce further incidence of heart attack with family history of heart disease. So that's the reason. It's not that everybody will get heart attack with family history of heart disease. It is only 16%. We can reduce further by improving your lifestyle.
All right. Dr. Kumar, what is cardiac arrhythmia? If you could explain that, and also which type of arrhythmia is the most serious one?
Well, when we are talking about cardiac arrhythmia, it's related to the electrical abnormality of the heart. It's the irregular rhythm of the heart. So now we are not talking about the arteries of the heart or heart attack. We are talking arrhythmia, abnormal rhythm of the heart. So normally what happens that the coordinated electrical activity of the heart brings the cardiac contraction. But whenever there is abnormality in this electrical circuit, there is irregularity in the rhythm of the heartbeat, and that leads to what we call fast heart rates, tachycardias, or slow heart rates, bradycardias. So, well, there are many types of arrhythmias which are not bothersome. They're only like cause palpitations, but they are not life-threatening. But there are few arrhythmias which are very dangerous. So most dangerous, if we are talking about, is ventricular fibrillation. Ventricular fibrillation is a type of abnormal heart rhythm in which the lower chambers of the heart, which pump blood to the rest of the body, they don't contract. They're not able to pump blood to the body, and in that situation, the person can suddenly collapse, and he may require immediate intervention so as to prevent sudden cardiac death, cardiac arrest, and permanent brain damage.
Right. So, Dr. Nagamalesh, what steps should a bystander follow if he or she recognizes that someone, who they're with or someone in their vicinity is having a cardiac arrest?
So most important thing by the bystander is to recognize this is a cardiac arrest. So the first thing you should do is you should try to call the patient who is collapsed, who is not responding. You should try to wake him up. Otherwise, what you should do is you should feel the pulse or try to hear the heart sound with your ear. So if there is no heart sound, no pulse, if patient is not responding, then we can say the patient is having a cardiac arrest. So next step is he has to first start the chest compression. Even if he's not trying, that's okay. So you should start chest compression with the patient keeping flat on the floor, and you should try to get the help from those who are around him. So, and shift the patient as early as to the nearby hospital. So the most important thing is the chest compression. So most of the time what happens, bystanders start running away from the patient. So when patient is collapsed, you should be brave enough to keep him on the floor and start the chest compression once you recognize that it's a cardiac arrest. So thereby you can prevent permanent brain damage. If you have not done proper chest compression, you are taken to hospital. There is no use of doing resuscitation after a few minutes because the brain is already damaged. You can review the heart, but brain will not be functioning.
All right, Dr. Jain, as most people still don't know the difference between heart attack and sudden cardiac arrest, many people may mistake in recognizing symptoms. So how do you know if it's a primary cardiac arrest?
Cardiac arrest is very different from a heart attack. In heart attack, the blood flow to the heart decreases and therefore the patient gets chest pain, but the heart keeps pumping or beating. In cardiac arrest, the heart stops beating or pumping the blood, and that is why the patient stops breathing, because the brain is not getting enough blood to keep the breathing on. Even though heart attack remains the most common cause leading to sudden cardiac arrest, but it is not the only cause. The most common cause for cardiac arrest is abnormal heart rhythm, which is called as ventricular fibrillation or ventricular tachycardia, wherein the heart beats at the rates of 180 to 200 beats per minute and then suddenly stops. Other causes other than heart attack for sudden cardiac arrest are cardiomyopathy, wherein the heart muscle increases in size, or it's a dilated heart. Some genetic syndromes like long QT syndrome, short QT syndrome are also common causes. Cardiac arrest requires immediate treatment. It will not give you time. A heart attack patient will still give you time. You can take him to a hospital. He can be treated with some thrombolytic injections or treated with an emergency angioplasty. For cardiac arrest, you have only few minutes to save the patient. Therefore, the role of the bystander who is trained in CPR is very, very important, that this patient it is possible for this patient to reach the hospital, because those early 4-5 minutes are very, very important to stop this ventricular arrhythmia. The importance of automated external defibrillators and the training of people to use this is also very important, because a shock, electric shock, can revert this ventricular arrhythmia.
All right, Dr. Kumar, cardiopulmonary resuscitation is a life-saving technique. So what exactly happens during CPR, if you could explain to our viewers?
Yeah, cardiopulmonary resuscitation or CPR is definitely an immediate and life-saving procedure, and it should be started as early as possible, as already discussed by the other panelists. What we actually are doing in cardiopulmonary resuscitation is we are just taking over the function of cardiac chambers, which pumps blood. So we are compressing the heart so that it can pump oxygenated blood to the vital organs, especially the brain, because these few minutes are important if somebody has got cardiac arrest or ventricular fibrillation. If we are able to pump this oxygenated blood to the vital organs of the body, especially the brain, till the person gets his own rhythm, or he gets the help from emergency medical services. This oxygenated blood goes to the vital organs, and we are able to save him, and we are able to protect him from getting permanently paralyzed. So that's what we are doing actually in CPR.
Right. Dr. Jain, if you could tell us, is CPR treatment similar in women as it is in men?
Gender has nothing to do with the CPR procedure or CPR technique. CPR is a life-saving procedure where you are helping a heart to pump the blood outside to the remaining body, especially to the brain. Structure-wise, male and female hearts are same, and therefore the procedure is same. So, in fact, the compression also, which has to be at least 2 inches or 5 centimeters down, is also similar in both male and female. You want to save a life, so gender actually does not matter there. The procedure of CPR is completely similar in male and female patients. CPR has to be quick to save lives. We have a mnemonic which we use for layman, that is called doctor's ABCD. So DRS ABCD, D stands for danger, assess the danger for the individual who has fallen, and also for the standby who is going to save the life. Response, R for response, you see whether the patient is responding, whether he is conscious, he is able to recognize or tell his name. S is shout for help is very important, because CPR given by 2 people is much more effective than CPR given by a lone bystander. A is airway, you check the breathing. B is breathing, you check whether the patient is breathing or not. C is compression, which is the most important component of CPR. Compression is the procedure which is going to give blood to the brain. And D is defibrillation. So that is the electric shock given with the help of defibrillator. That is the mnemonic which you should remember all the time when you are learning CPR and when you are using it as a bystander. Doctors ABCD, DRS ABCD.
All right, so important to keep all this in mind. With that, we'll slip into a short break but return with more questions for the doctors. Stay with us. Welcome back. You're watching Health and Wellness, Save a Life, where we'll be talking about the importance of CPR and how it can help in reviving a person who's had sudden cardiac arrest. Let's go across to our doctors and ask them more questions about CPR. Dr. Nagamalesh, though your intentions could be correct, wrong or half knowledge can be dangerous. So when should you not perform CPR?
So first we should always understand when we should not do CPR. Person who's collapsed may not be a cardiac arrest. So if a patient collapses, it could be a syncope, that is, heart is still beating, BP is only low, so they usually recover after some time. So doing CPR on this patient is dangerous. Or patient is collapsed for many other reasons like a low sugar, or any other reason, we should not do CPR unless we are very sure that patient has got cardiac arrest. So the next question is whether half knowledge is okay. Half knowledge is okay because if you are alone with the patient, better to do chest compression. How you do it is fine. If you have seen some video or have some knowledge, till you get medical help, continue to do chest compression. So taking patient without doing chest compression is not going to help him. So if you take the patient to hospital without doing CPR, so even if they successful in doing CPR in the hospital, his brain will be damaged and is not useful. So whatever the knowledge, you can start doing CPR if you are alone with the patient.
All right. Dr. Kumar, a heart attack or sudden cardiac arrest is more likely to occur in people with existing heart problems or even diabetes. What information should they carry with them while they're going out?
Yeah, if somebody has already having underlying cardiac problem in the form of previous heart attacks or any cardiac arrest in the past, if somebody has undergone some procedures because of cardiomyopathy or having some pacemaker implanted in the past, definitely there are gadgets nowadays available. First of all, he should have a small summary of medication what he is already on and with the diagnosis in his pocket. Second, he can have smart watches nowadays we have which can give plenty of information about any event. They are kind of event recorders. And also these people can have some health related bracelets which contain information about what they are suffering from and what are the emergency things which they carry in their pocket and they may need anytime. Like diabetic patients can drop their blood sugar suddenly, so they can have these information in the pocket so that it will not delay. It will not do any delay while finding out what they are suffering from treatment.
Right. Dr. Jain, how does an automatic external defibrillator help a person who is in cardiac arrest?
So as I told earlier, the most common primary cause of cardiac arrest is ventricular arrhythmias, where the heart rhythm is not normal and the heart beats very fast. Most of the ventricular arrhythmias can be reverted with an electric shock. That is what the AEDs do. They are automated external defibrillators. They have two pads. One of the pad is attached on the right side and one of the pads on the left side below the nipple. It not only detects the abnormal ventricular rhythm but also gives a shock automatically. So even a layman or who does not have a lot of medical knowledge can actually use an automated external defibrillator. It is such an important device that it should be placed at most of the public places like malls, railway stations, bus stops, and some police stations. In fact, most of the marathons, when they are arranged, there is a cardiac ambulance bystand. This AED is a very simple portable device, so it should be available at such mass marathons also, because we do keep hearing of sudden cardiac arrests during the marathons. That is because some cardiomyopathies, like hypertrophic cardiomyopathies, these patients are vulnerable to get ventricular arrhythmias or abnormal rhythm when they exert and they suddenly collapse. So automated external defibrillator is a very useful device for saving a patient's life in a sudden cardiac arrest when the cause of sudden cardiac arrest is ventricular arrhythmias, which is so in 90% of the cases.
Right. Dr. Nagamalesh, how long does it take to recover after surviving cardiac arrest, and what precautions should people follow?
The recovery is, there are two components there. So one is the recover from cardiac arrest and the complete recovery of the patient. So recovery is instantaneous. So you should recover within 3 minutes after cardiac arrest once you start doing CPR. If they don't recover or if they take longer period, if you continue to do CPR, still it is useful. Sometimes it may take half an hour or 45 minutes to get back the rhythm. But if you are doing effective CPR, especially in the hospital, still we can expect some recovery of patients from this situation. So this is usually happens instantaneously when you are doing CPR. Once you stop CPR, it's not going to happen. So second thing is complete recovery of patient from whatever he had the cardiac arrest. So this depends on what is the underlying condition of the patient and how long you have done the resuscitation and whether resuscitation was very effective. So if resuscitation is effective, it is done on time, usually they open their eyes immediately after CPR once you get back the heart rhythm. So this what we see regularly in the hospital setting or in the ICU where patient had cardiac arrest and we are all available immediately and start doing CPR to the patient. But those who have done CPR at home, it takes longer period even if you get back the heart rhythm, because sometimes it will not be very effective, or by the time they reach hospital, it takes some time to get back the rhythm. So the brain takes longer period for the recovery. So second thing is the complete recovery of the patient. It depends on what is the underlying cause.
Right.
Maybe, it may be dilated cardiomyopathy or diabetic or heart attack. So it takes a longer period for the patient to.
All right. Well, thank you so much, doctors, for joining us on the program and talking about this very important issue in creating awareness about CPR. Thank you all for watching at home. Goodbye.